Thank you for joining us as we review the latest situation regarding COVID-19. I'm very happy to be joined today by Dr. Mark Parrish, and together we will review the latest updates regarding the outbreak, a closer look into the changing advice regarding travel, and our most recent recommendations for organizations in handling the pandemic. So first, Dr. Mark, as the situation remains very fluid and we have seen a lot of change in the past week, can you give us an update on the current status of COVID-19?
Yes, hello Giles, and thanks very much for that. We have seen quite a change this week, haven't we? The main one, and I think we're all aware of this, is this shift of the focus of coronavirus from the East, from China, to Europe. And the announcement by the World Health Authority of saying that this is now a pandemic. If you look at numbers today of cases, and they will be out of date, after I've said this, but it's just worthwhile being aware of the numbers, the overall concept of this. We've got more cases now outside China than in China, and that's very different to how we've seen before. So we see China having managed this outbreak with new case numbers really on the decline, very small numbers, and yet increasing numbers in other parts of the world, and that's particularly in Europe. If you look at our website and you look at the map showing these, you see these big red blobs all over Europe as more cases are discovered in Europe. As part of that, we're seeing governments putting in place a number of responses to managing the outbreak and the infection in their countries, and being aware that these responses will sometimes have quite a significant impact on individuals. From a medical perspective, what we understand about COVID and how to manage it and how to deal with it hasn't really changed. We know a little bit more about this virus, but we also know that the best ways to avoid it and to stop it is regular stuff like washing your hands, not touching your face, keeping away from people who have coughs and colds, and being aware that the mortality rate remains at about 2%. We're seeing different mortality rates at the moment in different countries, and that's probably because of they haven't yet caught up with the accurate numbers of deaths compared to cases that they've got in the country. The Chinese were very, very, very focused on this and have been maniacal in their counting of all of those cases, and that's where we get the 2% mortality. We're not always seeing that in other countries, which are taking a while to catch up. So we're seeing those different mortality numbers. But really, Giles, the thing that I find interesting, and I think this is the most relevant for many of our viewers, as well as the medical issues of this, is just the impact on travel and the border screenings and the border tightening up that we're seeing. Would you agree?
Absolutely agree. It's vital at this time, something we're challenged with both internally and with our clients and partners. And for that reason, our advice is that globally, any non-essential travel should now be deferred. The rapidly evolving nature and scale of the virus requires a global approach to travel advice. And this aligns with the WHO's proclamation of COVID-19 as a pandemic. A key consideration is to define or to redefine what essential travel actually is in the context of an organization and in the context of the pandemic. And it will be different for each company based on their business goals, based on their organizational requirements, and the company, and of course the individual risk appetite of the individual business traveler. In simple terms, in the current context, a traveler should ask themselves, do I really need to be traveling, and/or does my company believe it necessary for me to be traveling? And if the answer is no, then we recommend deferring travel until a later point. How long to defer the travel for is a complex question. So we are constantly evaluating the situation, and we'll change our advice when it's appropriate. We have clear escalation and de-escalation triggers, which we watch on a country-by-country basis. And this is important given that we're seeing regions and countries in different phases of escalation and in de-escalation, just as you mentioned, Dr. Mark. For example, already in China, we're seeing elements of de-escalation, but organizations should include de-escalation preparation as part of their ongoing planning and response to COVID-19. For the individual traveler, we've seen an escalating trend of disruption to international movement through flight cancellations, route changes, entry restrictions, quarantine measures depending on the country of origin, in addition to in-country disruption through limitations on movement, gatherings, possible lockdowns. We believe these trends will increase as the pandemic spreads, which will mean international travel will become increasingly challenging in terms of arrival, mobility in country, and potential return to the point of origin. And this is why our latest advice is to globally defer any non-essential travel. We see quite often, Dr. Mark, that organizations are challenged with staying on the front foot of the pandemic to firstly ensure the health and safety of their people, but to also ensure that they can continue their operations. So previously, your advice was to ensure organizations are sourcing the most accurate, up-to-date information, to communicate that information with their people in a timely fashion, to review and adapt their plans and procedures, and to try to anticipate the scenario of cases occurring within their organization or community. Dr. Mark, what else would you add or change to these previous recommendations?
I would make no changes to those previous recommendations, and indeed for a number of the organizations where we have been advising, assume you will have a case of coronavirus in your workplace and prepare around that. That has happened. And those organizations that had done all the planning and the preparation were well set up to deal with that. What we are all seeing now is that with different countries applying different measures, organizations are finding it hard to put across their entire company, but if they're an international company, one standard way of managing the disease and coronavirus outbreak. The example I would give is here in the UK, the government is looking at, I would say, encouraging herd immunity. And therefore, this restriction of large social gatherings, the issues about social distancing are less of an issue in the UK than maybe they are in other countries. If I look at Norway, which is right at the other end of the spectrum, they have locked down the country. You're not allowed to travel from one county to another. Healthcare professionals are not allowed to move outside the country. You are advised against any travel anywhere, and if you are on some public transport, stay at least a meter or two away from anybody else. That's a very different message. For our organizations that we deal with, it's how do you balance all of those, and when working with your workforce, particularly in workforces where you are in an organization that can't work so easily from home. You're in manufacturing, you're in distribution, you're in industry, you're in retail, you want to keep your business going. And that's where it's vitally important to stay up to date with these things. And we're advising these organizations all the time. I've had 3 phone calls this morning with organizations about this, putting in place some help for them based on the facts. And those facts are changing all the time, as you said, Giles. The medical facts are not changing that much. It's the application of policies and procedures by governments is what's changing, and therefore the knock-on border restrictions. That causes obviously all of the challenges we've just discussed. The other thing, and I think we will be hearing more about this in the coming weeks, is let's say the mental impact on this. These are unforeseen times. We haven't seen this happening before, not certainly in our lifetime. How do we as individuals deal and manage with that, particularly if our families are elsewhere around the world and we're not all together, particularly if our businesses are elsewhere and we're trying to communicate with them when we have people working from home, just as you and I are today, Giles. How do you deal with that? How do you deal with those mental challenges? Very important for organizations to think about the mental effects of that, to be aware of the positive impact of local phone calls, communications, video chats, which luckily we all have access to nowadays. It's much more easy to do this. That's the stuff I think we will see more about in the next few weeks as we start to get a better idea of how these different ways of dealing with the virus have been effective.
Excellent, Dr. Mike. Thank you very much indeed. That's very clear. And thank you very much for joining us for today's update. As the situation continues to evolve, please do get in touch to receive our up-to-date information, advice, or assistance regarding COVID-19. Thank you.